Hello, this is Dr. Gay from First Lake MRI, and this is a patient who is 32 years old, had a nonspecific injury 6 years ago and continued pain, and they came in for an MRI. So this is a coronal T1 image of the right elbow. This is the humerus coming down. We have the trochlear articular surface here. The ulna articulates on this side, and the articular surface looks nice. Again, here's the ulna. Along the lateral side, we have the radius, radial head here. Now here we have the capitellar articular surface of the humerus, and we notice here that you have dark signal beneath the articular surface, a little either marrow edema or sclerosis or a combination in the subchondral region of the capitellum. So we did a fat-sat PD image here, and we see that there is a small defect and some marrow edema. And here it is. This is an image that shows that halo of marrow edema, that small defect involving the cortical bone and the overlying cartilage. On this view here, you get a sense that the cartilage is absent. And over here, you can see some cartilage, and here there's a fluid signal, so cartilage is absent. We also have a stir sequence that shows us a little bit better here. So we have an osteochondral defect of the capitellum with surrounding marrow edema and a very small joint effusion. This is a sagittal image here. Here's the capitellum, radius. You can see that fog of marrow edema. The osteochondral defect is not well seen, but there is a shallow cortical defect, and again, the articular cartilage is absent there. So again, an osteochondral defect of the capitellum. Now, a lot of times we see these in the pediatric population. They're children who are athletes, and they have repetitive microtrauma, and they get a little piece of bone that dies, and it can sometimes be unstable or become displaced. This is an older person, and they had an injury of trauma to the capitellar articular surface. So in a younger person, I would call it osteochondritis dissicans, and in this patient, I would just call it an osteochondral defect associated with an old injury. And who knows, maybe there was an osteochondral defect here in his youth, and it just never went on to heal, and eventually dislodged. And so that is it, an osteochondral defect of the capitellum, pretty common place to have an osteochondral defect. And thank you very much.